ILERA EKO ILERA EKO let us work hand in hand.
The focus of our administration, as outlined under our team's agendas plus, includes improving health outcomes. To this end, we have enrolled the public servants in the ILERA EKO scheme, with the government covering 75% of all their premiums. Starting in August 2024, all Lagos State pensioners will receive the free 1-year ILERA EKO coverage, which will ensure their access to health care even while in retirement. We're doing all this to further our universal health coverage goal. The initiative we're launching here today further confirms Lashma's long history of improving healthcare accessibility. One of them is the new ILERA EKO Standard JARA Health Insurance Plan. And I want to commend Lashma because in the past 3-4 years, each time there's a new product or there's a new service or there's a new initiative, that I've been opportune to come and support them with. And I think they deserve another round of applause. And so this new insurance plan offers additional benefits and peace of mind by reducing the financial burden on medical bills. In this plan, we have heavily subsidized the health insurance premium to ensure that everyone can access health care. I call on the informal sector, which constitutes over 70% of the population in the state, to seize this opportunity and enroll on the ILERA EKO in order to reduce your out-of-pocket expenses and the huge payment of medical bill, which we all know that is common around here. I invite the informal sector also to come on board and ensure that their employees are registered and are enrolled on our ILERA EKO, as this will automatically reduce the expenses of the companies, especially for the payment of medical bills. Let me add here that the enforcement team to handle the implementation of the Lagos Health Insurance Scheme law and the domestication of the National Health Insurance Authority Act has been constituted and they've been well trained. Even though this administration believes more on enlightenment, engagement, and collaborative effort rather than enforcement, the law still stands to be implemented and obeyed. Therefore, violators of this law will not go unpunished when the enforcement takes its full course. And I think it's also important that I mention here, the Honorable Commissioner was also trying to verbalize it, that I just signed an executive order that will also further strengthen the initiative that we have here. The executive order will be published, I think, officially by tomorrow, and it will be circulated, where we're expecting all residents, to go on one plan or the other, and we will be working assiduously to ensure that this takes effect immediately. Thank you. Because that's the only way we can solve these are common problems. That's the only way. It's only when we get not only the informal sector, everybody also on the private sector, and we as government, working collaboratively and understanding that, it's like economic of scale. That is what will bring additional investment into health coverage, health funding, health spending. But more importantly, it will give a lot more people access to quality health services. And that's what we're seeking to achieve. And it's been done everywhere. So ours cannot be an exception.
Lagos Health is our wealth.